All right, today we are diving deep into our body's master control centers. We're going to explore what happens when these incredible systems, the very ones that run our entire lives, start to send out the wrong signals. It really is a tale of two systems.
I mean, have you ever stopped to think about it? Right this second, your body is juggling thousands of incredibly complex jobs, and you don't have to think about a single one. It's an absolute marvel of communication. But what happens when that network, all that wiring and all those chemical messages, starts to break down? That's exactly what we're going to get into.
So to really get a handle on these breakdowns, we first need to meet the two big bosses running the show, the endocrine system and the nervous system. They're both in charge of sending messages, but oh boy, they do it in completely different ways, and the results are worlds apart.
Okay, here's the easiest way to think about it. The endocrine system, that's like old school snail mail. It sends out chemical letters, which we call hormones, through the bloodstream. It's a bit slow, it gets delivered to a really wide audience, and its effects can stick around for a long, long time. Now the nervous system, that's the internet. It's zapping, lightning-fast electrical signals down very specific pathways. The action is immediate, it's targeted, and it's over in a flash.
So, what happens when the Postal Service completely drops the ball? Let's take a look at our first case study, diabetes mellitus. It's just a classic textbook example of when the endocrine system goes haywire.
The main character in this story is a hormone called insulin, and the best metaphor for it, honestly, is a key. Insulin's entire job is to unlock the doors to your body's cells so that glucose, the sugar from your food, your body's main fuel, can get inside and power everything up. Simple as that. Without the key, the fuel is totally useless.
Now, when everything's working right, the process is beautiful and simple. You eat something, your blood sugar goes up, your pancreas releases the insulin keys, those keys unlock your cells, the glucose goes in to do its job, and boom, your blood sugar goes right back to normal. It's a perfect, elegant feedback loop.
But in diabetes, that beautiful loop is broken. The whole insulin system just fails. Suddenly, all that glucose is stuck floating around in your bloodstream, completely locked out of the very cells that are screaming for energy. This creates this really dangerous two-part problem. Your cells are starving, and at the same time, all that extra sugar in the blood starts to damage your body from the inside out.
Now the reason for this system failure isn't always the same. With type 1 diabetes, the body's own immune system gets confused and attacks and destroys the cells that make insulin, so the body literally has no keys to hand out. In type 2, the pancreas is making insulin, but the cells themselves have become resistant. It's like the locks are all rusty and jammed, the key is there, but it just won't work. And you can see how this fundamental difference means the treatments have to be completely different.
And, managing diabetes isn't just about high blood sugar. Low blood sugar, which is called hypoglycemia, can be just as dangerous. A really great way to remember the signs is with this simple mnemonic. H is tired. Headache, sweating, a fast heart rate or tachycardia, and so on. It's a super useful little tool for a really complex problem.
Okay, so we just saw how the body's immune system can turn on itself and attack its own hormone-producing cells in type 1 diabetes. Well, what's fascinating is that this theme, the body attacking itself, shows up again when we shift over to the nervous system. So even though we're moving from the Postal Service to the internet, the culprit in our next case is surprisingly similar. Let's talk about multiple sclerosis, or MS.
So the absolute core problem in MS is something called demyelination. Just think of your nerves like tiny electrical wires. Myelin is the plastic insulation that's wrapped around those wires. In MS, for reasons we're still figuring out, the immune system attacks and just shreds this insulation. And without it, that electrical signal can slow way down, get totally scrabbled, or just stop altogether.
Now, because this damage can happen to literally any nerve in your brain or spinal cord, the symptoms of MS are all over the place, and they're notoriously unpredictable. It all just depends on which wires have lost their insulation. This could mean vision problems, numbness, issues with balance, muscle weakness, you name it. Basically, anything the nervous system is supposed to control is fair game.
This quote right here, it perfectly captures what's happening. It describes what's known as Lermit's sign. That electric shock feeling is the very real tangible sensation of a nerve signal going haywire as it tries to jump across a damaged, uninsulated part of the spinal cord. It's not a metaphor, it is a literal short circuit.
All right, on to our third and final case, and this one is really interesting because it kind of bridges the gap between our two systems. Parkinson's disease is a neurological disorder, right? It's a problem with the internet.
but its root cause is actually the failure to produce a specific chemical messenger. It's a breakdown that happens right at the intersection of chemistry and electricity. So what's happening in Parkinson's is that very specific brain cells are dying off. These are neurons in a little area of the brain called the substantia nigra. And these particular cells are the factory that produces dopamine, which is a critical chemical messenger for controlling smooth, controlled movement. So as these factory cells die, dopamine levels plummet, and the brain's instructions for how to move basically get lost in translation.
And just like our other conditions, there's a fantastic mnemonic to help remember the key signs. Just think of the word trap. T is for tremor, especially at rest. R is for rigidity in the muscles. A is for akinesia, which just means a slowness of movement. And P is for postural instability, which affects balance. This simple acronym really captures the main physical challenges of the disease.
So we've looked at 3 different diseases affecting 2 different systems in 3 pretty different ways. But here's the thing. When you zoom out, the fundamental approach to managing these kinds of chronic conditions shares a very similar logic. Whether you're dealing with a hormonal imbalance or a neurological short circuit, the goal is always proactive management. And this framework is universal. You have to recognize the signs and symptoms, you have to plan how you're going to deal with them, you have to take action with that plan, and then, and this is absolutely crucial, you have to evaluate if it's even working and be ready to change things up. It's this continuous cycle of managing the body's incredibly complex systems. We've gone from these big, broad ideas about communication all the way down to specific breakdowns at the cellular level. When you get right down to it, every one of these conditions is a failure in communication. So the big question is, as our understanding and our technology get more and more sophisticated, how close are we to not just managing the symptoms, but to actually repairing the lines of communication themselves? What's next?